Okay, so this is going to be a two-part series in connecting three medical conditions that are interrelated with one another but are often confused along the way. And this is G6PD deficiency, methemoglobinemia, and cyanide poisoning. Now, just as a brief overview, G6PD deficiency as a state can induce methemoglobinemia, and methemoglobinemia itself is second-line treatment for cyanide poisoning. Now, cyanide poisoning I'll likely talk about in the second video. So first, let's talk about what we already know about G6PD deficiency. And we know that this is a hemolytic anemia, and it is caused by an enzymatic deficiency of glucose 6-phosphatase. This is an enzyme implicated in the pentose phosphate pathway. And this is unlike the enzymatic deficiencies that are seen in glycolysis, like pyruvic kinase deficiency or hexokinase deficiency. Well, G6PD deficiency is the most common hemolytic anemia due to an enzyme deficiency in the world. In fact, 400 million people, 400 million, have a deficiency of this enzyme. Now, there are three types: G6PD B minus and Mediterranean. Now, B is the most common, but it doesn't have any clinical manifestations, so we kind of ignore it when we talk about its clinical significance. G6PD deficiency that's either minus or Mediterranean do have clinical manifestations. Now, this enzyme itself is responsible for the production of NADPH, which is a very strong reducing agent. Now, why does it matter that we have this reducing agent around? Is that because we do need to keep the iron that is attached to heme in the reduced form, which is the ferrous form, because the ferrous form can bind oxygen. But heme also has the porphyrin ring, and this is part of the hemoglobin, which also has that globin chain, right? Anyway, so we need to keep iron in the form that can bind oxygen, which is the ferrous form. Now, say for example, we are deficient in this enzyme. We can't produce NADPH. We don't have a reducing agent around, and we can't keep iron reduced. Well, we end up with iron in the opposite ferric form, which is oxidized, which is not reduced. Iron 3+, which cannot bind oxygen. And heme that has the ferric form of iron attached to it is known as methemoglobin. Methemoglobin. Now, what's the problem with methemoglobin? Now, methemoglobin compared to hemoglobin cannot bind oxygen. In fact, in a state in which methemoglobin is around, the hemoglobin that is already present becomes much more strongly bound to oxygen. It becomes less willing to even give up the oxygen. So what does that mean if we display that graphically? It means that if we have our hemoglobin dissociation curve, which is, let's say, the saturation of hemoglobin compared to the partial pressure of oxygen in millimeters of mercury. And let's say, for example, in our normal state, we have a curve that looks like this. Well, with methemoglobin around, there tends to be a leftward shift, which is going to be pushed in this direction. And a leftward shift means that we've increased our affinity for oxygen, which means that the hemoglobin that's around says, listen, there is very little of us functioning hemoglobin around, which means that since there's such few of us left, it means that all of us need to band together and hold on more tightly into oxygen. The problem with this mentality of holding more strongly onto oxygen is that that oxygen gets poorly distributed amongst tissues, and so we end up with hypoxia and cyanosis at the end of the road. Okay. Now, there are known triggers for hemolysis related to the enzyme G6PD. So let's list them. The triggers that we do know include number 1, infections. Number 2, drugs, particularly drugs that have a mechanism of action as oxidants. And we'll talk about this later. Chemicals famously include mothballs, also known as naphthalene, aniline, and henna, which particularly has a significance with the Mediterranean population. Now you can imagine a Mediterranean individual has an event, applies henna, and suddenly ends up in a hemolytic crisis. Now we know most types of hemolysis is extravascular hemolysis, and extravascular hemolysis you're seeing 3 things: anemia, splenomegaly, and jaundice. Okay, and these people say, for example, it becomes a crisis. It becomes severe. The enzymatic deficiency is severe when you have less than 10% of the enzyme functioning. So you can imagine the scenario, right? 4th trigger is diabetic ketoacidosis, and a 5th trigger is the ever famous fava bean. Which, the consumption of fava beans in the Mediterranean population doesn't always produce this type of hemolytic crisis, but it can in some individuals. Now let's connect this all together. We're saying that hemolysis due to G6PD deficiency as caused by any one of these triggers can lead to the formation of methemoglobin. Now, let's talk about methemoglobinemia itself as a state. There are multiple triggers that can induce the formation of methemoglobin, which is the hemoglobin containing the ferric form of iron. Now, just one of those causes can be a G6PD deficiency crisis. But there is a mnemonic that we remember called PANDAS. To remember the drugs that can induce the formation of methemoglobin. And you'll recognize as I go through PANDAS that a lot of them have to do with these triggers for G6PD. The P in PANDAS has a few, there's a few of them. There's phenazopyridine, and I'll go through each of them individually. Prilocaine, primaquine. The A is for aniline, N stands for nitrofurantoin or naphthalene. D is for dapsone. A is for amyl nitrite. S is for sulfonamides and silver nitrate. And let's just briefly go through each one. Now, phenazopyridine is a drug that's used to treat the symptoms of dysuria, often given to women with UTIs who want symptomatic relief. This has nothing to do, has no antibacterial effect. It's just purely to treat the symptom of painful urination. Phenazopyridine, I believe, is also known as Urostat or Pyridium. And it has a tendency to turn the color of the urine red. That also reminds me of rifampin. that reminds me of the dark urine that's expected with metronidazole. Prilocaine is a drug that's often also given with lidocaine. It's used as a topical or local anesthetic in dental procedures and dental work. I don't think you'll see this very often in common medical or clinical uses. Primaquine, you will recall, is often also used with chloroquine to prevent relapse of malaria. It is safe to use. I'm sorry, it is not safe to use in pregnancy. It is not safe to use in pregnancy, and it is contraindicated in, guess who? G6PD deficient individuals. Okay. Now, aniline is a chemical that's found in rubber and in herbicides and in dyes. And remember that this isn't just some, abstract dye. This is dye that's used to produce indigo, and indigo is used to produce blue jeans. So it's quite a prevalent dye. Nitrofurantoin used to treat UTIs, typically in pregnant women. If we were to prescribe nitrofurantoin, we'd usually prescribe it as macrobid. This would be about 100 milligrams PO, Q12 hours, 4, 5 to 7 days. Naphthalene, I just said naphthalene is the same thing as chemical found in mothballs. Dapsone, I'll mention dapsone with sulfonamides. Remember that, when used as antibacterials, they are significant in this step of the reaction in the formation of folic acid, the formation of DNA. They're significant here at this step, both of them. Remember that this enzyme here is dihydroopterate synthase. And dapsone and sulfa drugs have an effect at this step, acting as a PABA analog. And if it acts as a PABA analog, it prevents this whole step of the reaction from even happening. So the bacteria can't produce folic acid, can't produce DNA, can't function. Amyl nitrite. Amyl nitrite is used as a vasodilator, used to treat angina. Also has a temporarily euphoric action and is known as a popper, used as a drug. And silver nitrate. Silver nitrate is actually a caustic agent. It's used as a chemical, what do they say? Chemical hemostasis, particularly for wound management and wound care, especially in wounds that have hypergranulation or lots of granulation tissue in between. So let's say this is the granulation tissue, and this is in between two epithelial borders. And we basically want them to close together. Well, say you have, bits of bleeding vessels in here. What we do is we take something that looks like a matchstick. It's the tip of the matchstick, which has silver nitrate on the tip of it, and we just kind of, scrape it around in these areas. It causes effective hemostasis, so it stops bleeding, but it does cause a blackening, discoloration.